Welcome to the Living Liver Donor Evaluation process. This video will explain the process so you know what to expect. The first step is registration. Complete your donor profile online to confirm that you are in good physical health, you are 18 years old or older, you are free from cancer, active or long-term infections, and active substance use, and that you have a strong support system to rely on for emotional and physical needs during recovery. Next, complete the emailed consents. Next, schedule the Independent Live Donor Advocate Interview, or ILDA. The Independent Live Donor Advocate advocates on your behalf, protecting your rights and decisions. It is not ethical for you to be paid, pressured, or coerced into organ donation. If you have concerns about pressure or coercion towards donation, please notify the ILDA or any member of your donor team. After completion, the donor team will collect and review your medical records. The second phase is testing. We appreciate your willingness to donate. To make it easier for you, we will help you complete your evaluation testing at a local hospital. Donor evaluation testing costs will be covered. You will be provided with a donor billing letter that will be used instead of your insurance card for the completion of your donor evaluation tests. It is recommended that you continue to carry health insurance and maintain your care with your primary care provider during this process. All donors will need to be up to date on routine health care. This may include vaccines, colonoscopies, mammograms, and pap smears. If any medical issues are discovered during the evaluation, the workup of the identified issues will be billed through your medical insurance. We may ask that the follow-up be done by your primary care provider. You must stop all smoking, vaping, and drinking alcohol before completing your evaluation tests. The testing includes 1. Fasting labs at LabCorp or Johns Hopkins, blood type, blood counts, chemistries, metabolic health risk factors, and infectious disease history. 2. CT scan and MRI scan of your abdomen. These scans help us check if you have enough liver to donate to your recipient and ensure your remaining liver is large enough to support your body. Both parts will grow to full size in 8 to 12 weeks. The CT scan examines the size, arteries, and veins in your liver. The MRI looks at the bile ducts and fat content in your liver. 3. Cardiac testing. Ultrasound of the heart, echocardiogram, and EKG to evaluate heart rhythm. 4. Chest X-ray. And 5. If additional evaluation is needed, our team will reach out to discuss additional testing. The third phase is review. Once all the testing has been completed, our team will review your results to determine if it is safe for you to have a living donor surgery. We will also schedule an appointment for you to come to Baltimore at Johns Hopkins Hospital to meet your living donor team, which includes a surgeon, a hepatologist or liver doctor, a nurse, social worker, and a dietitian. You will also have a follow-up interview with your Independent Living Donor Advocate, or ILDA. In the following weeks, our team will conduct a thorough review of all the information that we have collected and will make a final decision about your candidacy as a living donor. You will either be approved pending, or declined as a liver donor. If approved, our team will reach out to discuss scheduling your surgery date for liver donation, which can be scheduled in 4 to 6 weeks from your final approval. Some donors may not be able to directly donate to their original recipient due to incompatible blood types or too small or too large liver size for your recipient. Paired donation or donor swap could be a potential solution that allows you to indirectly donate to your recipient by donating to another patient on our waiting list. In turn, another donor would then donate to your intended recipient. If you find yourself in a donor-recipient mismatch, please let your donor coordinator know if you are interested in paired donation. If you are approved, you will move to the final phase: pre-op, surgery, and recovery. The preoperative or pre-op phase starts when you are 30 days from your surgery. You will need to do additional lab work and be seen by our anesthesiologist. You will be required to come to Johns Hopkins Hospital for this pre-op appointment. Your surgery will be approximately 6 hours long, and your gallbladder will be removed during your donation surgery. Your hospital stay for liver donation will be approximately 5 to 7 days. After you leave the hospital, you should plan to stay within a driving distance from our hospital for a few weeks so that we can closely monitor you for any surgical complications. You will not be able to drive after surgery while taking narcotic pain medication. You will not be able to lift items that weigh more than 10 pounds for 6 weeks. Most donors are able to return to work in 6 weeks. The donor team will follow your recovery for the next 2 years. This will begin with your 1-week post-operative appointment in our clinic. You can expect to hear from the donor team for follow-up and labs at 1 week and 1, 3, 6, 12, and 24 months after your donation. If you would like to speak to one of our former donors, or if you have more questions about the donor process, please reach out to your donor team. Thank you for choosing liver donation at Johns Hopkins Hospital. Organ donation saves lives.